You've taken a whole load of my material there, Julie, which goes to show how far we have come, really. I would say, I think we've seen a shift in the last 3 years in policing, but I think for the last 10 years or so, there's been a really significant shift in the way that New South Wales Police particularly works with community organisations, and we have Maha, and we've got some friends from WDB CAS in Sutherland here today, and from some other services. So I work in an organisation that sits between government and the services doing the really tough work on the ground with victim survivors and their families. I feel very honoured to do the job that I do, and I get to work with a whole range of people from government ministers at a state level and also some of the federal ministers as well. But also I think probably some of the most inspiring stuff that I get to do is coming out talking to community, and particularly connecting with victim survivors and hearing their stories and thinking about how we can improve the systems and processes that we have, because we've come a long way, but there's still a significant way to go, I think. It's only really in the last 5 to 10 years that we've stopped thinking of domestic and family violence as being a private, hidden family problem. We've had some really significant advances. I think at a policy level, we have a thing called the National Plan to reduce violence against women and their children, and we're on the fourth phase of that now. It runs till 2022. And I was lucky enough to be down in Adelaide about a month ago for COAG, and whilst none of the premiers and first ministers were there, all of the women's ministers and all of the ministers for the prevention of domestic violence and sexual assault from across the different states and territories were there, and it was a big 2-day conversation about where we are now. And where we need to go next. And there was certainly a very strong commitment there from all of the states and territories that at the end of the phase of this national plan, there needs to be another one. Whether that will go for 5 years or 8 years or 10 years or 12 years, I'm not quite sure. But the thing that struck me about that COAG meeting, and I'd again been fortunate enough to be at the one previously a couple of years before up in Brisbane, which was the first time that we got all of the states and territories together discussing this with non-political input. There was a huge groundswell of opinion and really shared vision about what needs to happen going forward. So many of you, if you don't work directly in this field, you'll think about domestic and family violence services as being refuges, and that's certainly a really core part of the response system that we have here in New South Wales and in other states and territories as well. But there are also a range of other different types of service response. So we have the Women's Domestic Violence Court Advocacy services here today, and they work really closely with police in New South Wales. It's not a model that exists in all of the different states and territories, and they are a key partner in terms of being that that frontline response to women who have been referred through police to support. I would say one of the biggest gaps we have in New South Wales, and it's the topic of conversation whenever we go out and talk in our social networks in other places, is around long-term safe, affordable housing. So, once women and children have been through that immediate crisis period, and let's assume they've got a really good justice response, they've got their ABO in place, just access to somewhere safe to live for a long term. So we also have another really quite progressive program which has been running here in New South Wales called a Safe at Home program, and here in New South Wales it's called Staying Home Living Violence. And the idea, it fits nicely with that shift around making perpetrators accountable. So the idea is that wherever possible she's kept safe in her home. She can continue to go to work or study, kids can remain in school, and he's removed from the premises. And there might be security set up around that arrangement so that she's able to stay safe, and she's not the one that is responsible for having to uproot her existence and start again. So that's another really important part of the system. We also have a number of different, I guess, prevention and early intervention programs. Women's health centres throughout the state have played a really important part in this for the last, 20 years or so. And, they run a number of different responses. Often doctors and GPs can be a really good first line of response. And certainly in the last kind of 5 or 6 years in New South Wales, we've started working with places like the Royal Australian College of GPs and others to try and educate them, because we know a significant number of women are not going to recognise that they're in an abusive relationship, possibly until after the fact. So just having, I guess, more widespread recognition of what abusive behaviour looks like, and being able to, equip a range of different people to be that kind of frontline response is really important. So we've got the women's health services, GPs, surgeons as well are starting to come on board in this space, because certainly they're seeing some of the more extreme physical impacts of violence as well. But then thinking about it in that broader context, so we've talked a little bit about education, but actually we should be doing this with kids when they are at the very youngest age. It's too late to start when they're teenagers. That's way too late. Primary school ideally, but really early childhood has to be where we start talking about what healthy relationships look like and what they are, what respect is. And you can have this, these conversations with age-appropriate language and models, but being able to really start to drive the principles of that prevention stuff that you were referring to from, the earliest stages all the way through education systems and into workplaces, which is interesting given some of the conversations we're having in our political spheres at the moment. I think what we've seen in the New South Wales Parliament in the last couple of weeks gives us some really interesting opportunities to reflect on the culture of violence against women, sexual harassment. The Australian Human Rights Commission is out as we speak, going around the country, doing a really comprehensive investigation and a set of consultations around sexual harassment in the workplace. And what we know is, that if somebody is sexually harassing in the workplace, then it's very likely that they're probably doing that in other areas of their life as well. We're living in fascinating times, I think, for some of these conversations. We think about the global context. Me Too is 12 months, a little bit older than 12 months old now. We know certainly that, many millions of women across the world, and many men as well, have been sexually harassed within their workplaces, but have also experienced, hugely the impacts of violence in the family context and in the domestic partnership context as well. And so for me, this is one of the reasons I feel really lucky to do what I do, because I'm living in an age now where I get to come out and have these conversations. I think about, there are women who have been working in this space for 40 or 50 years, working at the coalface, often unfunded. Many of the refuges that were the first responses to domestic violence were started up by volunteers and donations. But we're now at a time where we have a service system that is funded, perhaps not quite as much as we would like it to be, but it's funded. And we do have things like education programs in schools. So New South Wales, 3 or 4 years ago, introduced domestic violence into the New South Wales curriculum. It was the result of a 14-year-old teenage girl who wrote to the Minister for Education at the time and the Minister for Prevention of Domestic Violence and Sexual Assault. Her mum committed suicide, and she was a long-term survivor of domestic and family violence. And Rachel, the 14-year-old, said, "Why wasn't I taught about this in schools? It's not good enough." So where, activists in this space have been working for many, many decades, sometimes it takes, an online petition and 100,000 signatures gathered in the community by a teenager to actually start to affect change in this space. And that really inspires me. So we now have domestic violence as part of the curriculum in PDHPE. There's still a long way to go. We still need to do some training with those teachers, and we need to work with them around what they do when there are disclosures in the classroom, but we're seeing really significant shifts. And part of that, I think, also is due to advocates like Rosie Batty and others who've really spoken out and used the opportunity to be incredibly brave and turn quite horrific circumstances into something where we can start to have conversations within our communities that tackle the roots of violence, particularly against women, but also against children as well. I think we'll probably talk about this a little bit more later, but Our Watch is the National Prevention Foundation, and that's an institute that is part of the national plan to reduce violence against women and their children. And they've done some really significant research over the last 4 or 5 years, which basically it's pretty incomparable to the rest of the world. We're not, the rest of the world is not putting the same kind of level of investment into prevention that we are here. And what Our Watch says is that in societies where gender inequality is, pretty entrenched, then that leads to those attitudes that support violence against women and against girls. And later this month, I think in a couple of weeks' time, we'll be getting the results of the National Community Attitudes Survey, which is run every couple of years. That will give us a really good sense of whether we've shifted in the last 2 years, because those attitudes that young people hold are also reflected very much in adults too. So we know, there are significant numbers of adults who think that there are rationales or reasons or excuses when women are sexually assaulted. And if you apologise and you show regret afterwards, then that is somehow acceptable. What we really need to do in terms of shifting stuff over the next generation or so is to have incredibly coordinated efforts. So in the same way that we've resourced big public health campaigns, anti-smoking, seatbelts, drink driving, we need to put that kind of energy and focus and responsibility into this issue as well. And I firmly believe that we can shift this stuff within a generation or so. We now have a number of big corporates, small businesses, local councils, others on board, and they are so keen to be a part of this movement, really, because it has to be a movement of that is based in community. Police will never, I don't think you disagree with me, Julie, police will never be able to solve this alone, and neither will governments, and neither will services working at the front line. It has to be a coordinated effort. So the idea that this is everybody's business, I think, is something that we're really working to promote wherever we go. I think that's all I need to say for now, and we can have a proper chat.
Thank you, Moo.